COVID-19 vaccine task force will just give us what this really means for the country. Dr. Kwale, thanks for making time for us this evening. How significant is this declaration by Moderna and the signing of this MOU to have Moderna set up a vaccine center here in Kenya?
Thank you, Trevor. I must start by saying this is wonderful news. It's absolutely exciting, and it is indeed significant for Kenya and the African continent. As His Excellency has just stated there, last year, such a time, we were in this situation, we didn't even know where we would be getting the vaccines. And everybody was saying we need to start manufacturing vaccines where the problem is. We needed this on the African continent. So first and foremost, it's significant that we are now moving towards local manufacturing. And secondly, I must say the technology of messenger RNA, which is the technology of the future, is a technology we need to adapt and have on the African continent, because it is going to be used to produce vaccines not only for COVID-19, but for very many other infectious diseases, and including even diseases and conditions like cancer and diabetes. So it is going to put us on an extremely good footing going forward.
Yeah, but does this mean now that for Kenya that we will spend less on the vaccines, and the vaccines will be, and Kenyans will be prioritized now that we'll be part of the countries that manufacture it here?
Yeah, I mean, last year you saw about nationalism. People held back on their vaccines. You saw what happened in India and in even other countries. But to me, what is significant, and if you read that statement, is the drug substance will be produced here. That is a very important ingredient. That is really what makes the vaccine. You can have a factory, you can have any facility, but without that drug substance abuse, then you can't produce that vaccine. And if it is locally then obtained, then definitely the cost of the vaccines will be down. And then we start addressing the issue of access in terms of the cost, and access in terms of availability.
Yeah. Will there still be need to be vaccinated every year, like the flu shot? Have you gotten to a conclusion on that?
This is a disease that we are still observing. I must say the good thing is that vaccination and other measures that we put in place, we are now seeing a reduced number of cases, hospitalization and deaths due to this. But that does not mean that we drop our guard. We should not throw caution to the wind. We will need to continue observing those public health measures. And then more importantly, we need to get our vaccination. I urge Kenyans to be fully vaccinated. Those who have got one dose should get 2 doses. And also those eligible for booster vaccination must get it, because this is what we are seeing helping very many people outside. And now with this manufacturing capability coming, then we will be better planning to have this readily accessible to our people.
Yeah. Before I let you go, Dr. Kwale, you had mentioned earlier on that we will still have more vaccines than just COVID-19. Would you mind giving me a list of the vaccines that they will then be generated here?
Yes, as I've said, one of the things we need to also remember is that Kenya is among the countries where in 2024, Gavi will be winning out from supporting us on the childhood vaccines. That is the polio, the measles, the tuberculosis, that we've used in our children. And we are expected that by 2024, we should be manufacturing those vaccines here. So that is on course. With this investment, that will make it easier. But let me also say that other diseases, there's a lot of research in diseases like Ebola, in HIV, in malaria as well. And the platform of the future will actually be messenger RNA. So it puts us in a very good position, and our scientist involvement, capacity building of our scientists here, I think this is going to ensure that we become the hub of excellence on the African continent.
Dr. Willis Kwale, thank you so much for making time for us this evening. That's Dr. Willis.